Good morning. Oh, well done, everyone's awake, great. I'd like you to take some time and think about the last time you heard of technology being used to help a community, to help a government doing its work, and what is the image that you have in your mind? Probably something really positive and worked really well, right? Whether you were perhaps on the policy-making side, where you went through a traditional policy-making process of spending months and days and weeks and hours in a room developing something complicated, such as good healthcare policy at the federal level. And when you got towards the end of this process, someone said, well, how do we make this work? And a version of the tech will save us. Someone said that, and you said, great, we'll create a website. We'll just toss over this policy to the technologist, and we trust that they'll make it work. Or maybe you were an engineer or a technologist in your community, and you saw something wrong, such as potholes in the city, and you said, I know, if I just create an app, people can go in and say where the potholes are, the city will fix it right away, and magic, we won't have any more potholes in our city. This will be amazing. And in both cases, whether you were the policymaker or the technologist or just a resident in these communities or someone needing to use these services, what you actually found is that the tech alone does not save you. And so in the first case, as you can imagine, this is what happened with healthcare.gov version 1.0 of wonderful policy and a website that didn't quite work together. In the second case, it was more of the application itself, the apps itself worked in a couple different cities, but what cities found was that only certain parts of the cities had potholes reported, and only certain parts of the cities had roads that were paved. And so we have to ask ourselves, are we doomed to have technology and policy never work together well? Is this our future? Despite all of our technology and the Facebooks and the Googles and everything else we use, can we not have those same successes in our policy-making world and for our cities and for our communities? There is an emerging field called public interest technology. There's an emerging field called public interest technology. And this is really because we want a way to have policymakers working with the technologists together with the end user in mind to really deliver the best solutions for all people. And organizations, public interest organizations, including local governments and state governments and nonprofit organizations, have been working for decades to solve problems that really impact people's lives, whether it's foster care, whether it's health care, whether it's criminal justice reform. These organizations often exist, and public interest technologists, we try to use the modern technology thinking and processes, including design and research, testing and building, to help improve this process and deliver better outcomes for the end user. My name is Ofuro Gross, and I'm the Director of Engineering for New America's Public Interest Technology Program. And New America is by far not the first person or the first organization to ever think that, hey, we should put policymakers and technologists in the same room. We're not the only people doing that either, but I just want to go over a little bit of how we do things. So as you are thinking about how you can make changes in your community, how you can make changes for the city of Philadelphia, you may find value in some of these practices, and you can implement them in your work. So the first method that we use is really trying to reform the policy-making process. It's important to have your technologist at the policy-making table with you, so they can input and they can influence the policy-making process, so you don't end up with policies that can't be well implemented with the technology. But it's equally important for policymakers and community activists and the like to have input into the technical design process, because you want to be thinking, as you're designing the technology, how is this going to work? How is this going to affect privacy? How is this going to affect our laws? How is it really going to affect that end user? The second technique that we use is something called design sprints. This is something, again, that we're borrowing from existing methodologies that are used in other industries, including technology, but they're essentially short, time-boxed research periods where the research and the results of the research then are used to inform the strategies for implementation. And of course, the last thing that we do is implementation projects. None of this matters if we've all sat in a room for hours, we've talked to a bunch of people for hours, and we don't actually build anything, we don't actually test anything, we don't design anything, and we don't deploy anything. So implementation projects are especially important. Let me dive a little bit deeper and give you some examples of things that we've done at New America. So to hopefully bring these points home to you. With the reforming policymaking, earlier in this year at New America, we worked with a couple of other organizations to have an innovation summit around the Farm Bill. Being in Philadelphia, perhaps you think this Farm Bill has nothing to do with me because you don't read the Farm Bill like I do. But it includes a lot of things, including SNAP benefits, of course, which people in all types of communities use. And so with the with this innovation summit, we convened a wide variety of stakeholders. So not just your traditional policymakers that are often in the room, but we also convened technologists. We also convened some end users of the policy that are covered in this Farm Bill. We use some of these basic design thinking principles and this basic design thinking methodology to surface ideas in the room. And as an output of this innovation summit, a coalition formed amongst some of the stakeholders that were represented in the room. They were then able to take the ideas that were generated through this design building sprint, this design building summit, and use it to inform policy and legislation. This coalition ultimately even worked with a particular senator's office on pushing particular legislation. Another example we had is of actually running a design sprint with an organization called RCAP. They are an organization headquartered in DC, but they have offices around the country and stakeholders around the country. And they said, you know, we don't know that our technology practices are up to date. We have been doing the same thing in the same way for a long time. Can you come in and tell us what to do to improve our technology? So we did a short, time-boxed sprint where we stated we were going to look at their technology. And on a practical level, this looked like conducting a lot of interviews, doing a lot of different assessments of technology, and it also included revising our thesis and our assumptions as we went along and as we were learning things during the way. And what we found in this case is something that we find in a lot of different cases when we do these sprints, is that it's not just about the technology, but it also is about organizational structure, about communication practices, and about processes. And we're able to come up with recommendations that cover all of those aspects at the end of the design sprint, so that when an organization goes to actually implement their solutions, they focus on the whole picture and what is needed to improve the entire organization, and not just the one piece where they might have thought they needed to focus their efforts on. And as I mentioned a little bit ago, the design sprints and the reforming policy making mean nothing if you don't actually implement projects. And one such project that we've implemented at New America has to do with the opioid crisis. The opioid epidemic obviously is affecting a lot of cities across the country, including, I know, Philadelphia. And we have a public interest technology fellow, his name is Jeremiah Lindeman, who a few years ago unfortunately lost his brother to an opioid overdose. That led Jeremiah to actually use his geospatial and mapping skills to create what's called the Lost Loved Ones map. You can look it up, and this Lost Loved Ones map is available on a national basis, and people across the country can go in and put down a marker and upload a picture and a story of their loved one who they lost to the opioid crisis, to an opioid overdose. And this was important because Jeremiah was thinking, what about that end user, these loved ones who have lost someone to an opioid overdose? What do they need? They like to tell their stories. And then on a bigger picture, as far as changing policy, we want to make sure that we're telling true stories to change people's hearts and minds about this problem. So he created that. And from that Lost Loved Ones map, the next national map that we rolled out was a naloxone map. Naloxone, of course, being the drug that you can give after someone overdoses. And one of the challenges, though, is figuring out where you can go to give this. So Jeremiah was able to work with a number of local governments, city governments, state governments, and even some large national pharmacy networks to get a location, locations of where naloxone is available. So if you go to the naloxone map, you can type in your zip code and see what is available around you. And if you know of places, you can also use that map to input information yourself. And so this was the start of our opioid mapping initiative. But after we did this on a national scale, we said, what are other challenges people have? What do policymakers need to help help end this crisis sooner, and what skills do we have as technologists that we can leverage if we work together. So Jeremiah was able to go into Tempe, Arizona, and work with EMS, Emergency Medical Systems offices, and get access to their data. He talked to medical examiners to look at their data. He talked to local coroners to look at their data and said, what are all the data sets that we have? Can we combine them in a way so we can get one overall picture of how opioids are affecting Tempe, Arizona? And with his efforts, he was able to work closely with Tempe and some technologists there to develop this dashboard. And you can use this to show where overdoses are, to show where people have died of overdoses, to look at the stats with the breakdown as to race, gender, age, and a number of other dimensions. And this was great for Tempe. They were able to take this information, work with their policymakers, start to make some changes as far as how resources are allocated and the like. And we looked at this and said, this is really great. Probably other cities may need this too. And so through the Opioid Mapping Initiative, which has several cities and counties as members, Jeremiah started regular calls to create a network of these cities who were looking at how to use data to tackle the opioid crisis. And in these regular calls, people share information as to what they're doing. They share the dashboards. The dashboard I just showed you is now being used across the country. It's been customized in Alameda County and in California. It's being used in northern Kentucky. It's being used in Chicago. It's being used in New Jersey. And so cities and counties in different states are now been able to take this and share lessons learned across the community to really affect change that they need at their local level. This even extends into New Jersey, into Bergen County in New Jersey. And what's interesting about the Bergen County example is that they took what had been done and they said, we want to do more. We don't want to stop at just sharing information back to the community. That's important, but how can we further engage? And so you see on the right side of your screen there, the Bergen County prosecutor's office actually now tweets some of the results of what's on the map, places where someone was revived from an overdose, places where naloxone is available, and those types of information to really engage with the community so people understand what's going on in their community. The map on the left shows where people have overdosed, where people died of overdoses, the types of treatment they got in response. And this, when we talk to an analyst in the county's office, people are saying this is going to be able to help inform how resources can be allocated and can be reallocated. And so what that means is you can now target your training to areas where you see the most overdoses. So where there are the most of the dots on the screen, this is probably where you need to go send the most information about the signs of addiction, about where people get the drugs. And so people in the community are vigilant and can see the signs more quickly. It also ties into efforts that Bergen County has in working with their Child and Family Services office, where they actually send recovery coaches after people have been overdosed. So because of the information here, they're able to figure out the right number of people that they need to have trained and where they need to be deployed. And so what I find most impactful about the work that Jeremiah has done through this opioid mapping initiative is that it's a really good test case and a really good example of how public interest technology can work. So Jeremiah started with his personal example of being affected by a problem and saying, what can I do? I'm a technologist, what can I do? Let me think of those end users, the people who've lost loved ones, and what do they need? And so he created the loved ones map. And then we took it from there and said, okay, we've met some needs of one user. What else can we do? Let's reach out to policymakers in a city. Let's see what you need. And let's pull together people who have the right skills, who have access to the right data, and put it together in a way that it's relevant to both policymakers and those end users to make decisions. And then from there, we went and we created this ultimate network of people, because when you figure out how to do something that works, it's nice to pat yourselves on the back, but it's nicer to share it with other people and to have that bigger and wider impact. impact. And so with the opioid mapping initiative and with using these public interest technology principles, we're able to share some of these learnings across the country to affect more communities. And so by really keeping that end user in mind, by using the technology skills with the policymakers, bringing people together throughout the process and using it also as a feedback loop to inform new policies and new efforts and a new allocation of resources, you really have a successful example of what public interest technology can do. I could give you some more examples about what's been done in other areas, but I just wanted to also briefly touch on this recovery map that has also been launched by a partner through the Opioid Mapping Initiative. And this recovery map, we started with the lost loved ones, where you're putting in stories of people who died of overdoses, but the recovery map allows someone who's recovered from an opioid addiction to go in and tell their story, to go in and inspire others for how they were able to overcome their addiction and to make a difference. And so we're, again, hoping this changes hearts and minds and really leads to action on the parts of individuals. And so with that, as you think about what to do here in Philadelphia and you think about what to do next, I just want you to keep a few things in mind. So first, keep the end user in mind. Technology is great, policies are great, but really at the end of the day, how are your end users, how are the residents of your community actually going to be affected? How are they going to engage in policies? How are you going to make sure that policies that you write or technology you develop is actually able to be used by your end user and doesn't just sit on a shelf somewhere? The second thing is to make sure that you consider both tech-informed policy development and policy-informed tech development. I'm an engineer. I think engineers are amazing. A lot of other people don't share this viewpoint. Thank you. One person in this room also thinks engineers are amazing. But really, again, without putting it in context, without making sure that what you're developing as an engineer or technologist is really taking into account policies and those end users, it doesn't matter, because we end up with problems at the end of the day. And so finally, as I started with, right, with someone saying in the room, the tech will save you. The tech alone will never save you, but by using these public interest thoughts and by keeping your end user in mind, the technology will certainly help you. Thank you.